Hi, I'm Dr. Michael Verbora. Welcome to the Stoned Age. So my name is Dr. Michael Verbora. I'm a family physician, but I'm an expert now in medical cannabis, and I serve as the Chief Medical Officer of Alethea Health, which is a medical cannabis company in Toronto, Canada that grows medical cannabis and treats patients through various clinics. It helps them use cannabis safely to help their chronic issues typically.
So what got you into medicine?
So medicine in general, I've always done well with mathematics and science for the vast majority of my life. I've always gravitated to the analytical mind, I think, more so than the artistic mind. And I grew up my whole life, and I told people I actually wanted to be a neurosurgeon, a brain specialist, and that's pretty weird for a kid in grade 3 and 4 wanting to be a brain surgeon. So somebody probably planted the seed in me, maybe a dad or a mom. And yeah, I always took care of people from a young age with plastic toys, and I had doctor kits that I carried around, and I never really thought twice about it, to be honest with you. And I kind of grew up my whole life just telling people I was going to be a doctor, and one thing led to another, and yeah, now many years later, and after a long journey of education, I'm very proud of the fact that I'm a physician, and I'm proud that I'm a family doctor, not a neurosurgeon, but a family doctor who can help patients not only with their disease, but how the disease affects their quality of life, the family members around them, and try to offer solutions to helping them.
That's great. Now my question to you is, why are you specializing in cannabinoid medicine?
So how I came to medical cannabis therapy really was by chance, and as many things in life are serendipitous, this was as well. I was just about to graduate family medicine from the University of Toronto, and I chose a medical cannabis clinic as my last elective, mostly because I wanted something easy before starting my practice. And it was actually the opposite. And when I went to the clinic, my expectations were not the same as what I encountered. It was actually extremely complex, and it was extremely hard. The patients I saw had very significant diseases. There was children with very severe forms of issues, and the medicine we were prescribing was super complex. It was unlike any other medicine, so it actually was extremely challenging. And I remember the very first patient I met was a 5-year-old boy, and I spoke to the parents for about 40 to 50 minutes, and then I learned that their child was on cannabis and that they were using it to treat seizures. And for me, I was just about to graduate medicine. The expectation was that I knew as much as I could. And at that moment, I had an eye-opening experience. I realized I knew nothing, and I still had so much more to learn. I didn't know cannabis was a medicine. I didn't know that there was CBD and THC. And when I found out from that family that CBD was the only thing that helped their child with their seizures, and they had such a hard time accessing it, and there was very few doctors that could help them, but how it made such a tremendous difference in that child's life, making him a normal kid again, and essentially curing him almost of his epilepsy. I knew at that point in time that patients needed help, and they needed somebody with credibility, and they needed somebody to do the research and help them navigate accessing cannabis. And so I decided kind of right then and there, I went home that night, spent a lot of time thinking about it, and said I'm going to dedicate part of my career to becoming an expert at this, ultimately to help patients.
How did you come to terms with that? I mean, treating such a young child with cannabis,
Yeah, well, the first feeling I had when I went into the clinic was, this doctor's crazy. The doctor I was shadowing, a mentor, I was like, what is he doing? He's giving weed to kids. And all I was taught was that cannabis was bad. I was taught that if you use cannabis, there's a high chance that you're going to become addicted to it, and you have a use disorder. And that's all I knew. I was just taught in psychiatry cannabis was bad. But I went home and I started to read, and the physicians there also gave me some education material and some reputable sites and some journal articles. And I started to read and understand first the endocannabinoid system, and I learned, oh wow, there's actually a system in the body. Like, I just thought cannabis was an intoxicant. And then I realized, no, there's actually a system. And I studied the system and how the system was a master communicator in the body, and it helped the brain and the immune system communicate. And I started to kind of rationalize through a scientific, I guess, understanding for myself, well, actually, this is a very valuable therapeutic target. We may not have all the answers, and we definitely don't, but there's a lot of science here, and there's a good explanation and a good reason as to why so many people across the world are using cannabis and getting medicinal relief. And then you combine that scientific inquiry that I went through myself with the 50 stories I heard on the first day of how patients were able to get off of their oxycodone or their Percocet, or they stopped using their Xanax for sleep. And I started to put them both together and said, well, I have a chance to really excel in a field that's very new, and I also have a chance to really help patients use something at that time I knew now, after educating myself, was actually a lot safer than some of the other options. And so it was kind of that moment I decided I'm going to do this, and I committed to it, and there's no looking back.
That's great. It must feel good that you're being able to help children in particular with problems that they're not going to be able to find any sort of relief through traditional medicine.
Yeah, absolutely. One of the biggest challenges in Western medicine is that sometimes we don't have all the answers. And the worst feeling as a physician is when a family comes in and tells you, we were told there's nothing left, or there's no hope. And stealing somebody's hope is like, blowing out the light. And you have to continue to inspire and instill hope in patients. And cannabis is just another option. I can't say it works 100% of the time, but it does work very often, and it can make a very big difference in their quality of life, especially for patients suffering with chronic illnesses. And so by just first relighting that candle and telling them, look, there's at least another option, there's different cannabis products and formulations, we can go through them one by one, we can try. I may not know if it's going to work for you, but there's hope again. And that alone is very therapeutic in and of itself. And then when you watch them start to take the medicine and you start to get the results, then they can go on their path, their journey to helping themselves heal. And cannabis is really the nidus for starting that journey, for them re-engaging with themselves to help them heal.
So if you were to have a patient that was to walk into your office and say to you, well, okay, I have a 5-year-old that is epileptic, and I want them to use cannabis as a form of medicine, but I want them to use medical cannabis and not regular cannabis, what would you say?
Yeah, so there's a lot of things in that question, but first things first, like, not all epilepsy is the same. So different epilepsy has different levels of evidence. Some epilepsy does very, very well with traditional pharmaceuticals, and people do exceptionally well. And I would say if they had a condition like that, they should go with that, because there's probably more research there. And there's unfortunately no point at this time to experiment with cannabis if there's a really safe option that's going to work well for you. The second point is that, yeah, medical and recreational cannabis have a lot of overlap. So the products are really the same. The ratios of CBD and THC can be slightly different, and we do see medical patients gravitate typically to higher CBD strains and lower THC strains. And recreational tends to be the higher THC. And then the way that they deliver the drug or medicine is different. So recreational users typically look for a fast effect, so they want to feel good quickly. And so they usually will inhale it or smoke it, whereas medical users are looking for a prolonged effect. They want to feel good all day, and so they want to ingest it typically, and so that they can get the benefits for 16 or 20 hours when the disease is bothering them. But yeah, there is a lot of overlap in the medical and recreational. The problem is it's really just about the dose. So if you take a dose that's enough to really impair you, then you're looking for a recreational effect. And if you take a dose that's typically not impairing, you can get a lot of medicinal value at non-psychoactive doses. That would be the main distinction, I think, between the two. And I think educating people on that is really important.
Yeah, because there's some people that kind of think they're two different things. It's like two different plants.
Yeah, I think one of the myths is that CBD is medicine and THC is the party drug, and it's not true. CBD and THC are both medicinal. THC has recreational value. CBD does not have any recreational value. The difference with THC, whether it's medicinal or recreational, is the dose and the intent. And so if your intent is to be high and dissociate, then you're going to take up typically a higher dose and inhale it. If your intent is to feel well and to reduce pain or anxiety or improve insomnia, you're going to take just the right amount that you need to get the effects that you need, not extra.
Got you. Does cannabis help children with ADHD or ADD?
Yeah, so anecdotally, I do have, what I would say is complicated, very severe forms of ADHD that I see in my practice, usually in young children or teenagers. Usually there's something else going on, like I see a lot of overlap with Asperger's or autism. There's a little bit more evidence to date on autism and CBD, and there's some studies out in Israel that have shown it to be relatively effective from an observational perspective. Unfortunately, there's a big disconnect between how some people are medicating with cannabis for ADHD-related symptoms and what the science shows. So do I think it can work? Probably. Do we have enough science to say it works? Not yet. And so given those circumstances, I typically reserve the use of cannabis to some of the more extreme cases until the science kind of catches up.
So is there science behind the use of particular cannabis strains and the application or method for the dosage? And are those linked to a particular medical illness or ailment?
So this is what's so interesting about cannabis, because it comes predominantly in flower, and each of those flowers can be different strains, or we call chemobars, which can have hundreds of different ingredients. The pharmaceutical world likes one ingredient, and it likes to be able to patent it, and so protect the investment into research so that you can get 10, 15 years of protection on the drug. But cannabis, you can't patent the flower or the plant. So it's a bit of a disincentive to do some research. So we do know, though, that some companies have found ways to get certain cannabis ingredients into formulations like a spray. And with that spray, they've sponsored studies on MS-related pain or spasticity, and they are able to report what the typical dose is. And so we have some information on the dosing and the different product ratios of CBD and THC, and we're getting more every single day. But at the end of the day, the current state really forces physicians when prescribing to start low, go with typically higher CBDs and lower THCs, and then slowly build up, the CBD and or the THC in a stepwise fashion, and really personalize the treatment to the patient. So while we're waiting for research to see if everybody responds the same way to cannabis, to the best of our knowledge, every one of us is unique, and our endocannabinoid system is extremely unique. And I can take, if I look at my data set of we have about 70,000 patients in our clinics across the country of Canada, and if I look at that data set, I can pull out the same condition, let's say fibromyalgia, and I may find in my data set that 50% do really good on CBD, and then 50% do good on CBD with THC. So something different is going on between those patients, and patients are much more than just their diagnosis, and because it's the endocannabinoid system, it's a master regulator and target. I don't know if the science is going to show that everybody should be using the same thing for the same condition. It might be a little bit more art when it comes to treating people with cannabis.
And that's kind of a little bit like the pharmaceutical drugs that are available for certain things. For example, antidepressants. One person would react differently on, say, Zoloft as opposed to Prozac, right?
Yeah, absolutely. So we started to do a lot of genetic testing, at least when it comes to antidepressants, and so there's been studies going on that certain people metabolize drugs differently, and how they respond to certain drugs may be different, all dependent on their genetics. And so at least in the city of Toronto, like if I'm worried that I can't find an antidepressant for somebody, if I'm prescribing that, I can send them for a genetic test, and it will actually recommend what the highest chances of success are. But you're right, not all drugs work for all people, and there is trial and error, even when we have good science. There's always a number of people who don't respond to a drug. There's always potential side effects depending on the drug itself, and the doses can be very different for each of us. But the way that we study pharmaceuticals is to go through a very rigorous, controlled method where different people will get different doses, and we try to find the most effective dose for the most amount of people. So it's really, we just push it towards statistics, but at the end of the day, and a patient comes into my clinic, I don't treat a statistic, I treat a patient, a human. And so I have to take the statistics to guide me and to help me make informed decisions, but at the end of the day, we have to listen to what the patients tell us.
Do you have any tips for anyone that want to talk to their doctor about using cannabis as a form of therapy?
So my first tip to patients is, one, educate yourself. And the problem with something like the internet is that education has never been more accessible in the history of the world, but access to good quality information is also becoming more and more difficult. And so you have to find a reputable source of education to first educate yourself on what the benefits and risks are of cannabis. And so anything that's saying that it's completely risk-free and safe is not going to be reputable. And anything that's saying that it's only harmful and addictive is also not reputable. There is a middle ground there that is the scientific consensus. So one is you need to educate yourself. I think two, you need to probably take that education and bring it to your doctor. We still live in a world where most physicians are not educated on the endocannabinoid system. Medical schools still aren't typically teaching this. Very few doctors take it upon themselves to be educated. And then very few will even prescribe it or authorize it. So there's a lot of hills there to potentially climb, but hopefully, if you have a good relationship with your physician, you can bring it up to them, you can maybe even print them out research papers, show them some evidence for your condition. And if they can't necessarily help you, hopefully they can refer you to somebody who has the knowledge. And the good thing about cannabis slowly, growing across the globe in terms of medical access is that there are more and more physicians who are starting to see the benefit and are starting to educate themselves, and it is slowly creeping its way into the medical curriculum. And so there should be, ideally, a physician that is educated on the topic and can advocate for you or help authorize you if it's the right form of treatment.
What are your thoughts on the evolution of the consumption of cannabis for medicinal purposes?
So it's really interesting, the evolution of medical cannabis. This is historically probably one of the oldest medicines on the history of the earth. We've dug up graves in China from 5,000 to 10,000 years ago. We see people buried with the cannabis plant, perhaps in a ceremonial, religious fashion and or medicinal fashion. So it's probably one of the oldest medicines. And, unfortunately, a lot of propaganda, stigmatization started to come in many, many years ago, predominantly in the United States. And there was perhaps some motives there to block access to cannabis, and then everything stopped. And so it went from actually being a pharmaceutical in many different medicines in the United States, for example. In the early 1900s, it was a medicine and an ingredient in many different cough syrups or sleeps or anti-anxieties. And the American Medical Association fought and said, no, don't criminalize cannabis because it's actually a very good medicine and we're using it. And unfortunately, they decided to label it a level class 1 drug in the United States, and then other countries slowly followed, and the next thing you know is nobody has access to the plant. Nobody's allowed to study it. All the medicinal products that were on shelves had to be pulled. And then it's not until, 50, 60 years later where when we should have been studying the cannabis plant and all of its therapeutic effects, we instead studied the opium plant, which does have medicinal properties, but it has a much higher risk of abuse compared to cannabis. And now we find ourselves, at least in North America, amidst a opioid crisis, where in Canada 4,000 people a year die from opioid overdose, and in the United States is somewhere between 25 and 30,000 people a year dying from prescription pills. This is quite devastating, obviously. But we're finally on a renaissance, and it's 100% driven by patients. At the end of the day, it's the child who had no other options but to try CBD, and a doctor hopefully with some courage to put them on it to get that case report and start to influence people, politicians, regulators, industries, to start considering this as a genuine medicine. And so I am really excited. There is a global renaissance in cannabis research taking place. And I look forward to the next 20, 30 years of studying this plant to see what it really can do. And I'm very optimistic that we're going to have many medicines when it comes to cannabinoid therapy.
Synthetic cannabis versus naturally grown cannabis. Which is better as a medicine, or is there a difference?
So there are a couple of different synthetic cannabis products, at least in the North American markets. The benefit of having a synthetic is that it's one ingredient. You can turn on a factory and print as many as you need, essentially. And so access is always there. When you compare that to a plant, it takes time to grow a plant. It takes 3 weeks, 4 weeks to just kind of getting it to start growing, and then it takes 3 to 4 months before harvest and drying. to get it into a patient's hands. So there's a lot of barriers there when it comes to natural medicines and getting, scaling to the potential need. The benefits is that synthetics also are that you can study it a lot easier. So you have a patent if you create a synthetic molecule that looks like THC or looks like CBD or one of the other ingredients, and then if you prove it works for a certain condition, you can get it as a drug number, and then usually insurance companies may cover it, governments may cover it in public healthcare systems, so there's economic upside of that model. The problem is that the research, when you compare synthetics or isolated cannabinoids all on their own versus the whole plant and the whole plant extract, the research shows that it's the whole plant that is probably working better. And so we call this the entourage effect, and essentially it's that the sum of all the ingredients in the cannabis plant work better together rather than individually. And there's a study that they looked at this. They looked at pure isolated CBD versus whole extract CBD with all the other different ingredients such as cannabinoids and terpenes. And they found in pediatric epilepsy that the patients who used the whole extract, first of all, they needed lower doses, they achieved greater results, and they had less side effects. And so it starts to make you question, is synthetic the best way to go in the future with a lot of new therapies, when at least this plant is starting to show us that all those ingredients may be there for a purpose, and they may start creating more of a balancing effect in the body, which may reduce potential side effects and may actually have a higher upside to clinical benefit. So I wouldn't say that one is better or worse than another. I think the science at the end of the day will tell us what we should use for what type of conditions, and we should follow that. But so far the science is pointing to the fact that the whole plant in its natural form is best.
A little bit on that same vein, organic cannabis, GMO cannabis.
Yeah, so there is a big organic movement. It's hard not to miss it. I think it's just really important. Unfortunately, a lot of people take advantage of trends, and so the word organic can be kind of slapped on a lot of different products, and is it genuinely organic or not? And what does organic mean, and what type of regulations are in place? So you need to look to the organization that's regulating it, right? There's some organizations that allow people to do certain things and that I wouldn't consider organic, but they'll still give it a seal of organic. And so this is where you have to kind of do your own due diligence. I don't know much about GMOs, and I'm not too sure if there's GMO cannabis seeds coming out, and I'm sure there's going to be interesting technologies. I think at the end of the day, we have to just study these and see if there is a difference. To the best of my knowledge, there's not much difference. The only concern I have as a physician would be is if cannabis is grown with pesticides. We do know that if you heat certain pesticides, you can get very toxic byproducts such as cyanide, which is poison. So for me, it's more about having regulations on how to grow it and testing the final product before a patient vaporizes it or ingests it, so that we can have a list of what's in the actual product before someone puts it in their body, to make sure that any of the ingredients in there that aren't the natural cannabis plant are not going to be toxic to the individual.
I don't know if you're aware of this thing called Sacred Plant. They do like this series on YouTube and stuff like that on medical cannabis and stuff like that, and they're kind of saying that if you ingest it, the negative effects of, say, the pesticides or whatever affecting your body is lower than if you were to smoke it, because it goes through like your liver and everything. What are your thoughts on that?
Yeah,
It makes sense?
To the best of my knowledge, if you are ingesting like potentially harmful pesticide, your stomach acid that's your first barrier of defense essentially, and so there's a chance that your stomach acid could neutralize the threat, versus when you inhale it, you're heating it. And so some of these nasty pesticides, they're actually not harmful if you ingest them, but it's when you heat them that they become problematic and they convert into molecules that are harmful. I think it really depends on probably the specific pesticide, but yeah, in general I would say that that's probably mostly true.
Do you have any patients that are unable to access the medical cannabis, and how has that affected their life, if you do?
Yeah, so it's really interesting. In Canada we have universal health care, so one of the Canadian core values is that we don't define your ability to access health based on your ability to pay. So it doesn't matter if you're rich or you're poor. if you need medical care, we're there to give it to you. However, we do not extend that value to therapeutic options. So once you need the medicine that the physician prescribes, once you need the herbal plant that the physician prescribes or authorizes, there's usually a big stop in coverage. The government typically only covers certain populations, either really young people, really elderly people, or people with disabilities. And so people have to seek out private insurance. So it's a bit of a confusing system in Canada. And the problem with medical cannabis is that it's been slowly becoming adopted. The Veteran Affairs does cover medical cannabis for patients, for veterans in Canada, up to a certain amount. But other than that, nobody else is having their medical cannabis covered. Now, the cost of medical cannabis can be $200 to $300 a month for some patients because they have to use cannabis every day to allow them to function, allow them to treat their seizures, reduce their spasticity, or improve their insomnia. And that can be really expensive, especially if this person hasn't been able to work for a while, if they're on disability, or if they have other medical issues that prevents them from working. And so the cost is the biggest barrier. And we have been working with a number of insurance companies in Canada, and every day I do see more and more insurance companies covering it, and that's how the vast majority of Canadians at least get insurance. So I'm optimistic that with time and more research that more and more people will get it covered. But absolutely a big percentage of my patients, as high as 30 to 50% I would say, really struggle with affording this medicine, to the point that some people have to choose between feeding themselves or medicating for themselves. I'm only hopeful that insurance will step in, governments will step in to help them, or patients will hopefully, work together to grow it themselves, or do what's necessary to make sure that patients who really need this medicine to function get access to it at, an affordable price.
Last question. Given your experience and how cannabis, medicinal cannabis, has impacted the lives of your patients and Canadians in general, how do you think it will impact Barbados and the Caribbean?
So for me, I think, having been in the medical cannabis industry and doing work in this field for the last 4 years, I've seen such dramatic changes in the way that patients approach their health and wellness. Cannabis is a tool. It, takes us away from the pain for a couple of hours. It helps us sleep a little bit better at night. It quiets the mind sometimes when it's ruminating on things that don't bring in any value but actually just add stress. And when you take away those things, or you improve those things that are so important in our life, it allows you to function better. And it allows you to take the next step forward, which may be starting that exercise program, changing your diet, going to yoga or doing meditation, or engaging in more social functions. And I think that is really at the center of what health and wellness is. Everybody's trying to feel well. Not everybody is really sick and needs cannabis. There's a lot of people who aren't sick or don't have lots of diseases, but they're also not well. They're very stressed out. They might have mild anxiety, they're ruminating, they're not sleeping well, and they're looking for something to help them as well. And it's stress that is the cause of so many diseases and so many problems, and inflammation. And cannabis, I'm optimistic that with time, as the research comes out, you're going to find that cannabis really is a very effective option for stress. And I think that eventually one day, and I hope science will show this, that cannabis will be used as a preventative way, that we can kind of tackle some of these problems that accumulate and start as small problems and become big problems or big medical issues. I'm really optimistic that we're going to find that cannabis can do that. The Caribbean islands, and Barbados in particular, I think the opportunity for them, one is to leverage some of the universities they have here. They have some medical schools. I think so that's a great opportunity to educate physicians and perhaps be leaders on educating physicians, because unfortunately it's been very slow in many countries around the world to bring education to the medical curriculum. So I think that's one opportunity. I do think that there's obviously patients here, like there is in everywhere else in the world, that suffer from insomnia or chronic pain or epilepsy, and I think that they would benefit from medical cannabis. I think the biggest economic opportunity, however, for the Caribbean and Barbados is probably going to be tourism. And I think that there are an abundance of places in the world where you can go and get an all-inclusive alcohol package. And there are more and more people like myself who are kind of getting tired of that. And I think more and more people are looking for healthier alternatives to alcohol to relax and rest. And I think that the biggest opportunity in the Caribbean is to create these spaces where people can go and use cannabis safely, and they can have either a recreational experience or a medicinal experience or a cannabis spa related experience. I think that's the biggest opportunity for the Caribbean, and it'll be interesting to see if they can get things together to capitalize on it. So as the Chief Medical Officer at Alethea Health, my role really has been over the last few years to take all the data that we've been collecting on 60, 70,000 patients, try to publish as many research articles. We're very fortunate that we published in a peer-reviewed journal that 1 out of 2 patients coming to our clinic stops benzodiazepines, drugs like Xanax or clonazepam, and will switch completely for medical cannabis. And that's obviously very positive because cannabis can't kill you, but those other drugs can. And we've trained now, fortunately, probably over 100 different doctors just in our clinic network. We're building what we think is the largest data set in the world on medical cannabis patients, and we hope to leverage that data set to be able to tell our growers on the farm what strains should they grow for what specific conditions, or what types of patterns are we seeing in the clinics, so that we can really have a really strong vertically integrated company all the way from what are we growing to what our patient is using. And I think that's a very unique model that isn't being really done anywhere in the world, and I'm very proud to be part of that team.
So how would you be, oh, not how, just how, but would you be utilizing the cannabis, Caribbean grown cannabis at Alethea, that's it, yeah?
So yeah, at Alethea Health, we do have a lot of international relationships. We have relationships in Australia with some of our partners there. We have relationships in Germany where we ship products to pharmacies. And I think we're always looking to find people in different countries who are passionate about cannabis, who typically are medically focused, because that's our focus. And what we really provide to them is acceleration. So we say, don't make the same mistakes as many other companies did in Canada. Let's help you go from your idea of becoming a cannabis company or a grower or a clinic or whatever it may be in the industry to selling your product or providing patients with education or whatever it may be that your business idea is. Like, we try to help patients go from A to Z as fast as possible without making mistakes by giving them access to all our intellectual property. And so that's our vision, is to strongly align with people who have the same values as us in the medical field.